Unity Point Health Allen Hospital is celebrating 100 years as part of the Waterloo and Cedar Valley communities. The history of Allen Hospital is ingrained with stories of philanthropy, purpose, and evolving medical expertise. The hospital opened in 1925, but the story begins well before that, when Henry B. Allen moved to Waterloo in 1857 at the age of 23 to practice law. Henry rose to prominence in the community and invested in farmland north of Waterloo. In 1900, he sold all but 80 acres of his land, which is the plat where Allen Hospital and Allen College sit today. Henry and Mary Allen later moved to California, but they were ever fond of Waterloo and the life it allowed them to build. When Mary passed away in 1913, Henry donated the final 80 acres, along with $200,000, to establish a hospital in her honor. From 1922 to 1925, construction was completed entirely by Waterloo residents, including sourcing materials from Waterloo suppliers. And Allen Hospital opened to the public on February 15, 1925, and immediately admitted 25 patients into its care. A few days later, the hospital's board of directors met to inaugurate a 3-year nursing educational program to help satisfy staffing requirements so the hospital could meet the needs of its community. Soon after, the nursing program admitted its first 5 women. At this time, the hospital had 130 beds, 54 employees, a separate maternity department with 14 baby bassinets, and bus services. With World War II coming to an end and more women choosing to stay home and raise children, the nursing shortage had become dire, and the hospital was operating on only 1/3 of the needed nursing staff. Growth continued at Allen Hospital with 2 wings added that included an operating room, labor suite, nursery, and pediatrics, as well as the Allen Professional Building on the west side of the hospital. The new additions generated acclaim, and in 1957, Allen Hospital was named the best equipped hospital in Iowa. At the School of Nursing, a radiologic technology education program was started to satisfy increased demand for imaging technologies that could diagnose illnesses earlier than previously possible. More additions came in the 1960s, as a new 30-bed mental health unit was constructed at the hospital, as well as the opening of the Allen Women's Health Clinic and a medical technology program for lab services. Dr. Frank Coyle joined Allen Hospital as a vascular surgeon and was a driving force for the successful cardiac program we know today. Following the 50th anniversary celebration in 1975, Allen Hospital added a cardiac catheterization lab for non-invasive cardiovascular procedures. Ambulatory services opened next, allowing surgical procedures to be completed without admitting the patient for an overnight hospital stay. The first open heart surgery procedure was completed in 1982, a landmark achievement that opened the door for more than 7,500 such procedures to have occurred since. It made Allen Hospital a destination for life-saving cardiovascular care for patients throughout Northeast Iowa. Later, in the 1980s, a major construction and renovation project that included a new main entrance, lobby, and chapel was completed to make the hospital a comfortable and welcoming place for scores of patients and visitors. In 1989, Allen College of Nursing was incorporated as a degree-granting institution of higher education, and less than 1 year later, the Iowa Board of Nursing approved a Bachelor of Science in Nursing program, with the first class graduating in 1994. With the construction of Girard Hall, Allen College opened its new campus north of the hospital. The building was named after Dr. Russell Girard, a longtime physician at Allen Hospital who's remembered for his philanthropy and lifelong commitment to quality healthcare in the Cedar Valley. 1995 marked an alignment with a new organization called Iowa Health System, which allowed hospitals throughout the state to work together to provide more efficient care to the population as a whole. This was the foundation for the health system we know today, Unity Point Health. Allen Hospital continued its investment in convenient outpatient care for the community with the unveiling of United Medical Park. This facility was called a medical mall and offered enhanced access to several primary care and specialty providers. Allen College of Nursing officially changed its name to Allen College in 1997 due to the growth of programs that extended beyond nursing practice, and the first class of students with an Associate of Science degree in radiography graduated in 2000. Allen College continued to expand throughout the 2000s and began offering health sciences programs. Later, advanced tracks such as doctoral degrees in nursing and education, a Master of Science in Occupational Therapy, and a Doctor of Physical Therapy program were added. With a rich history of serving rural communities, Grundy County Memorial Hospital in Grundy Center and Community Memorial Hospital in Sumner became affiliated with Allen Hospital shortly after the turn of the century. A generous $5 million gift was received from the estate of Pauline Barrett, which is the largest single gift ever received by the Allen Foundation. The Pauline Barrett Pavilion opened in 2009 as a new home for the Emergency Department and Heart and Vascular Center. The addition of various specialty services came next as healthcare teams continued to work closer together for the benefit of patients. Iowa Health System changed its name to Unity Point Health as another signal of more cooperative healthcare services across different access points. In response to population growth in Cedar Falls, Unity Point Health opened a new outpatient medical facility at Prairie Parkway, again housing many specialty services and providers all under one roof. This was made possible by a capital campaign that raised $14.5 million, which also contributed to improvements at Allen College and the Allen Hospital Birth Center. Throughout history, community support has been a cornerstone of providing healthcare services to all patients in need. Allen Hospital is proud to celebrate its 100th anniversary with the community it serves and looks forward to caring for patients when, where, and how they need for generations to come.